Well, welcome back to the Brighton Chamber Podcast. I'm your host, Cameron Harris, and today I'm joined by Dr. Andrew Chambers from YourChoice Direct Care. Welcome to the studio.
Yeah, thank you so much for having me.
Yeah, so what is YourChoice Direct Care?
Yeah, so YourChoice Direct Care, we are, like it says in the name, a direct primary care office. So before I usually go into what is direct primary care, because it's a pretty different model in terms of the approach to primary care, I like to talk about what problems in our current system it's designed to address. I think we've all experienced some level of frustration in the current medical system, whether that's lack of access or whether that's pricing and kind of being surprised by bills and things like that. And I think a lot of the problems in that come from how we've switched over to this third-party payer system or an insurance-based system of payment in terms of medical care. So basically, direct primary care aims to kind of fix the problems that come up with that model. And there are a lot, but I would say the three kind of big ones that come to mind for me is inflated cost of care. Third-party system exists because medical care is so expensive. And to address that, they say no one can pay for this on their own. So you have to have this third-party payer come in to pay for medical care. But then the third-party payer introduces layers of complexity that adds more cost, making it more justified to have a third-party payer system, if that makes sense. It's kind of like a feedback loop of increasing costs. And then to keep up in that system, primary doctors have to schedule their day from 7:30 to 5 every 15, 20 minutes, 20 to 30 patients a day. So that means for a patient, really decreased access. You call your doctor, you want to get in for an acute issue, you get quoted 3 weeks till next appointment kind of thing. I would argue that decreased access and layers of complexity and algorithms and kind of you have to do this before you do that, and this evaluation or this medication is not covered. Those kind of things, it gets in the way of the patient-doctor relationship. So it's a cost issue, it's an access issue, and it's a patient-doctor relationship issue.
Mm-hmm. Oh, definitely. I remember going to urgent care a couple of years back for this one specifically, where I mostly saw a nurse for the whole visit, and then 5 minutes probably for the main doctor, comes in, talks for a second, and then he's out the door. So it kind of just makes you really feel like a number more so than anything.
Yeah, for sure. And actually kind of the reason that urgent care exists, is because the emergency room is so expensive, and primary care doctors who really can handle all of those urgent care level complaints are too busy to handle them. So instead of seeing, your primary doctor who did your physical, you have, an infection come up of some kind, you want to be seen for it, you want to have an evaluation, you're basically going in, waiting a couple hours and seeing a complete stranger who doesn't know you, who is, looking at their list in the waiting room of 30 people waiting. They're good willing people, but in some instance, you kind of have to be a number for them to get through their day, Whereas if, you're able to get in and see your primary doctor who knows you, there's already a relationship there.
Mm-hmm.
Yeah.
So how is direct primary care different?
Basically, it simplifies the payment model, right? And it brings it back to a direct relationship between a patient and their primary care provider, their primary care physician. So how that works is it's a kind of a flat monthly fee. For us, that starts at $69 a month, and it increases by age and complexity of the patient. And our nurse practitioner sees people starting at $59 a month as well in our office. But basically, under that flat membership fee where you have kind of cost certainty, what you're paying, monthly or even annually, depending on how you bill it. You know exactly what you're paying. Within that, you get unlimited visits. So if you feel like you have to come see the doctor weekly for a problem until it's resolved, you could do that. And in addition to that, you get same or next day access, right? Because if we're billing through this membership model, I don't have to schedule my day at 15-minute intervals from 7:30 to 5 p.m. So if someone calls and they say, hey, I think I just threw my back out or something. Can you come take a look? I'm kind of worried about it. I say, yeah, 11 o'clock right now. Can you come at 3 o'clock today? I can't come at 3. Okay, well, how about 8 a.m. tomorrow? I can get someone in same or next day. We guarantee that, same or next business day. So right there you have, price transparency, you have access. And then because we are able to kind of not schedule our day that way, in addition to access, I think you restore the patient-doctor relationship. Included in that also is 24/7 direct access to your doctor, right? So if you have a problem you don't really need to be seen for, but you're just kind of like, hey, I have this rash, you send me a picture, we start the first line treatment option for it. And I say, hey, if it doesn't get better, like come see me, right? So we've done that all over text. We've saved you time. We've saved you money, and the convenience of being able to handle that directly with someone who already knows you.
Mm-hmm.
Yeah, so it through that subscription model, and then there's some other things included in that I'm sure we'll get into as well. But yeah, that's kind of the basic idea of it.
Yeah. So you mentioned pricing. Can you give me like a rough outline of prices? And you said it differs by age.
So our rates, like I said, our nurse practitioner rate starts at $59 a month, and then ours for myself and Dr. Savage starts at $69 a month, and kind of the max rate is $99 a month, and it kind of goes up by decade, basically. So yeah, the exact details of like the pricing and by decade, it can be found on our website, because I don't want to misquote anything there, but yeah, so it's basically between $69 and $99 a month, depending on age and complexity.
Sweet. So what should people come to your practice for? Like, what do you guys specialize in to where they should come see you versus seeing some other specialty facility?
Yeah, for sure. I think that's actually something that's kind of unique to it is we are able to spend extra time with people. Like from the outset, all of our appointments are scheduled for at least 30 minutes, and we can very easily change that to 60 minutes. So I think that frees us up to, do a little bit more research and cover a little bit more than maybe the standard primary care office. There are things that we can't handle there, right? Like I'm not going to take your appendix out bedside, you know what I mean? So there's definitely still times where it gets to the point where you say, yeah, I think we need to get some specialty referrals, but I think we're able to spend a little bit more time, do a little bit more research, and kind of come up with a plan that works for people. But generally speaking, myself and our nurse practitioner, Nikki, are family medicine trained. So we see newborns all the way up through geriatrics. Dr. Savage is internal medicine trained, so he provides primary care for adults. But really, it could run the gambit of anything. Yeah, really any organ system, any problem, whatever we can handle, we will. And if we need to get some specialty assistance, yeah, then it would just be a referral like any primary care office. One thing to note on that, we also do stock our own pharmacy in the clinic. So we get like deeply discounted, like wholesale prices basically for pretty much any primary care medicine that's generic, right? So it's been out long enough that there's not like very, very high prices on them still from patents and things like that. As an example, I could treat like high cholesterol for 90 days for less than $1 for a 90-day supply.
Wow.
Yeah, and same with like high blood pressure medications, get you 2 high blood pressure medications for less than $3 for 90 days. So it's a pretty dramatic difference in terms of even what you see from like a GoodRx price to get these medications wholesale. And if we make a plan that includes them, I'll step out the room, go grab them, and basically fill them for you same day. You walk out with the medications that we talked about.
Sweet. So you don't have to run to the pharmacy elsewhere. Well, what would some of those prices, like to compare, what would some of those prices at other pharmacy or GoodRx be?
It's pretty variable depending on insurance. So some of those medications, they've been out for a long time, so they're not super expensive. But I would say generally, even like the GoodRx prices, most of the time, because I'm just fascinated with this. Like ever since I've started there, I'll check and be like, I just filled that for that cost, and I'll check GoodRx, and it's usually close to like 1/10 of the cost of the GoodRx pricing. And then the reason I don't have like a price comparison is because it's so variable based on like pharmacy benefit managers and insurance plans and types of coverage in terms of what that pricing would be. Yeah, it's a very rare situation where a generic medication you can get cheaper somewhere else.
Mm-hmm.
Yeah.
So say one of your members, somebody has a membership at your facility and they're out of town and they suddenly need medical attention. What would you recommend that they do?
Yeah, for sure. So I think this comes in with that 24/7 access, right? So they could text, they could call, they could send me an email and basically tell me what's going on. And again, similar, like if I think they might have acute appendicitis or I think they might need a surgery or they fractured something and they're out of town, at some point I have to have them seek attention elsewhere. But if it's something that I can handle over the phone reasonably and go through, you're not having X, Y, or Z symptoms, you don't have red flags that make me concerned for this or that, we can start the evaluation while they're out of town. Even just a couple weeks ago, I had a patient who was traveling internationally to a third world country for a business deal that he was going to do, and He was, concerned that he had something that would need an antibiotic. We talked through it. I was able to send it to a pharmacy. I think he was somewhere in Texas at the time. He picked it up. Didn't end up even needing it, but I just kind of gave him the red flag symptoms. If you do need it, this is when you take it, and he was able to do that. Yeah, and I think it was within hours of when he was leaving too that he called, and we were able to get it done in time, which was good. But I just think that level of access is so different than really what you get from most other kinds of models of care.
Well, there's no way he's getting that medication with other plans, other facilities.
Yeah. I
soon at
think
least.
So. Yeah, and it's kind of a bummer because he was out of town, so he couldn't get it through our pharmacy. But that antibiotic I could have got him, and he could have come picked up, if he was in town at a very low cost comparably. But you can't do that from Texas.
Yeah, really. So with your memberships, is it like you can only have the membership and not medical insurance, or vice versa, or can you have both? What do you recommend?
Yeah, for sure. So we definitely recommend some kind of hedge against financial calamity, right? Because just like I said, things happen, right? You might need to get an appendix taken out or something like that. You might get a really bad diagnosis, and we're screening for cancer and things like that. And if we find it, I can't treat it, right? So you definitely need to have, or I guess we recommend people have some kind of other coverage. But I think this membership model gives you cost certainty for most of your medical care, for most of your primary care. And certainly in terms of your visits, right? There's no co-pays if you come see us. It's all included in the membership. We'll get you your generic meds that you need, things like that. And we've also worked to get negotiated prices for different imagings and further evaluations if needed. But definitely carrying some kind of additional coverage, I think is recommended. But I think cost transparency in your primary care allows you to make that coverage something like a high deductible plan with a health savings account, or something like a Christian health share ministry, or an indemnity, something like that covers hospitalizations, which is a fraction of the cost of a traditional insurance plan. And then it frees up your money for you to save, and if you need to use it, so be it. But if you don't, then you can use it for something else.
So say somebody walks in off the street and they need medical attention and they don't have a membership yet. Are you able to treat them?
Yeah. So in terms of them signing up, we're not a walk-in clinic, right? But if someone did walk in and they wanted to establish care and become a patient, especially right now, I'm new to the practice. I've only been there for a couple months now. So we're trying to get the word out. I would, happily take someone on in our free month promotion right now, where there's no strings attached. You can become a patient for a month, and the idea is either we're confident that it's going to work well enough for you that you're going to stay, or confident that you're going to tell people about it and spread the word. We think we've this model of practice, direct primary care, and I think especially the ways that Dr. Savage has worked to make primary care more affordable, believe in the model enough to say, yeah, I think we're either going to impress you enough, or that you're going to tell your friends and we'll impress them enough that people will join and stick around. We could definitely work with seeing someone for an acute issue, have them sign up for a membership, and hopefully that turns into a long-term primary care relationship.
Mm-hmm. No, that free month is huge, I'm sure.
Yeah.
Speaking of people walking in, where are you guys located?
Yeah. So we are kind of right next to Meyer off Grand River here in Brighton. The actual address is 8702 North 2nd Street. Suite A. It's kind of behind the bank there, next to Meyer.
Awesome.
Yeah, off Grand River.
Awesome. Well, as we're wrapping up, is there anything that you'd like to mention that we haven't touched on yet?
I think just touching back on the kind of synergy that you can get if you pair a direct primary care membership with something like a high deductible plan and an HSA. I think that's kind of like a really good model of synergy. Basically, the important distinction there is a high deductible plan, your monthly cost is dramatically decreased, right, compared to a traditional insurance plan. And then the benefit there is you have access to an HSA. For people who aren't aware, HSA, or health savings account, is a pre-tax savings account that you can use for healthcare expenses. The remarkable thing is, it's actually not taxed when you put money into it. And if you're using it for health, and you actually can invest it, right? So you put it in the stock market, so you're getting a return on that investment, and that's not taxed. The return on investment's not taxed. And even when you draw out the money, that's not taxed as long as it's being paid towards a health related need. So it's like a kind of amazing financial tool, but you can only access that tool if you have a high deductible plan. So if you pair a high deductible plan with an HSA and a direct primary care membership, you have cost certainty for your outpatient care. So you know you're not going to approach that deductible anyway, right? Unless there's some kind of financial calamity, unless you're hospitalized in an ICU or something really severe that has this really high cost, in which case the plan activates and you end up whatever you have to pay before the plan covers it in terms of that high deductible. You have that money in the HSA that you've been saving. Best case scenario, you never use that. You take it out when you retire. Great. But it's there and it's your money, as opposed to you're in this really high premium insurance plan. You've already spent that money. You end up not using it. It's gone. Yeah, we can kind of offer that price certainty in terms of your outpatient care. Just to contrast as well how much cheaper even services outside of our office we've been able to negotiate. I actually did look up the cost in like a local university health system, right, of something like your normal annual physical labs, right? So what they bill insurance for, pretty simple metabolic panel, thyroid testing, an A1C, which is a diabetic screen, and cholesterol testing. They bill insurance $646 for that. If you're paying cash, they do have a cash pay discount. They get you to $257. We've negotiated lab costs that I can order all those at a cash pay that doesn't run through insurance for $26. Same thing for even advanced imaging, right? So say a classic thing, someone has low back pain and it has red flags, right? There's something that makes me think there's something bad. There could be something bad going on here, whether that's like a radiating symptom of pain, or there's some kind of decrease in motion, something that tells me, hey, I got to make sure there's not something bad going on in this person's back. So we get an MRI of their spine. Same price transparency tool from the local university health system quotes $3,770 for that. We have contracted with a local imaging center to get that for $370. So 1/10 the cost. And I think that really plays into kind of what I was getting at, where direct primary care is trying to solve a lot of problems created by the third-party payer system, where you have this feedback loop of prices that are high. So we have to justify a third-party payer system, which makes prices higher, right? Mm-hmm. So direct primary care steps in and says, these prices actually don't have to be that high. If you're, approaching it from the doctor and patient with even cash pay rates in the setting of a high deductible plan in this membership, then you can actually be free to spend your money for the evaluation the way that you want. And you will, in almost every situation, end up saving money approaching your healthcare that way. Which is kind of remarkable. And we're also getting, I would argue, certainly better access, and I would argue better care, because we have more time with patients, and we're able to individualize care and find a plan that really works for people.
Mm-hmm. Well, it's just crazy that the work can actually be done for that price, but it's, 10 times as much, like you were saying. But speaking of HSAs, which what you mentioned at first made me think of this, so you don't get taxed on taking money out of an HSA if it's spent on medical, like a medical condition. Can you pay the membership out of the HSA and not be taxed on that cost?
Yeah, so this actually has been like historically kind of a controversial thing where it wasn't super clear. Some people were probably doing it and it was like murky, but a recent change in legislation has like definitively declared that you can do that. So then you're looking at like, okay, $69 a month pre-tax, you're probably being taxed at least 30%. So, if that's pre-tax, it's really closer to like $49 a month, if that makes sense, right? Because it's coming out of your paycheck pre-tax. I think another thing too that this model is really good for is small business owners or people who are self-employed. If you're employed by this big organization that can kind of risk pool and make even what I would argue is an overpriced insurance plan at least appear more affordable, then you can kind of get away with doing that, right? You might pay $800 a month for something like that through an employer. But if you're trying to free market purchase an insurance policy, my goodness, that's going to be close to $2,000 a month, right? That's going to be super expensive. For a small business owner, someone who's self-employed, this paired with a high deductible plan, a Christian health ministry, something like that, right? That's much cheaper then you have, like I said, that cost certainty. You can do that HSA, and it can make your healthcare expenses much more reasonable. We do also offer business rates for small business rates. I believe the cutoff is a group of 10 people or more. So it's an opportunity for a small business owner to say, man, I would really love to offer healthcare for my employees, but I mean, that's going to basically take up half the business budget, right? If you're doing that, at least, it's going to be crazy expensive. And it's really hard to manage for a small business. You could say, hey, I'll pay for your direct primary care membership, and I recommend that you get X, Y, or Z in kind of insurance type of insurance plan on the free market that's going to, not bankrupt you, and it kind of gives you the ability to offer something for your employees. And I would argue they end up getting better care and a system that makes a lot more sense.
That's huge. It's huge. So somebody's listening to this and they want to, get in contact, learn more, anything like that. Where would you recommend that they go?
So a couple different things. One, like I mentioned, we're doing this free month right now. So you could either go to our website, YourChoiceDirectCare.com, or you could call us at 810-224-5300. And you could either ask to set up that free month membership, or if you're kind of not super sold, you want to hear more about it, talk to us in person, come to a free informational visit. That's an offering that we do as well. Yeah, so you could either jump right in, do that free month, and decide, hey, this is really working for me, or maybe you decide, I don't know, maybe this isn't fit for me. But worst case scenario, you got 1 month of 24/7 access with unlimited visits, so you kind of get that service. Or like I said, if you want to just kind of hear more about it, sit down, talk with me or a nurse practitioner, Nikki. We'd be happy to kind of go through the details and see if it'd be a good fit.
Yeah. So we'll definitely include that in the description below. So anybody who's driving right now, they don't have to quickly write that down or anything like that. It'll already be there. So, well, Andrew, thank you for joining me today.
Yeah. Thanks so much for having me, Cameron.
Yeah. And thank you for watching, and we'll catch you on the next one.